Imagine walking into clinicals and your patient's chart shows 10 abnormal lab values. Which ones are emergencies? Which ones can wait? And what should you do first? Today, you'll learn the 10 lab values every nurse should recognize, and more importantly, how to think about them instead of simply memorizing numbers. Welcome to NurseWiz. Our mission is simple. We make complex nursing concepts easy to understand. Many students spend hours memorizing lab values. Great nurses don't just memorize them, they understand what the body is trying to tell them. Let's decode the 10 lab values you'll use throughout your nursing career. Before we touch a single number, you need a method. We call it labs. 4 steps, same order, every time. L. Learn the normal range. You want it cold, so abnormal registers the second you see it. A. Ask why it's abnormal. Numbers move because something happened in the body. Fluid, blood loss, infection, medication, organ function. Find the reason. B. Build the clinical picture. Put the lab next to the vital signs, next to your assessment, next to what the patient is telling you. S. Select the safest nursing action. Monitor, intervene, or escalate. Every abnormal value ends in a decision, and that decision is nursing. If you can answer these 4 questions for every lab, you'll remember them much longer than if you simply memorize numbers. Now let's run it 10 times. 1. Potassium, 3.5 to 5.0 milliequivalents per liter. Potassium controls muscle contraction and the electrical activity of the heart. When potassium is high, you may see peaked T waves, muscle weakness, and dangerous cardiac arrhythmias. When it's low, you see muscle cramps, weakness, and an irregular heartbeat. Your priority is the same either way. Monitor the cardiac rhythm, review the medications, and report critical values promptly. 2. Sodium, 135 to 145 milliequivalents per liter. Sodium drives fluid balance, and that makes it a brain lab. Low sodium brings confusion, headache, and seizures. High sodium brings intense thirst, restlessness, and neurologic changes. Your priority is to assess neurological status and monitor fluid balance, intake, output, and daily weights. 3. White blood cells, 4,500 to 11,000. White cells fight infection. A high count points to infection or inflammation somewhere. A low count means the patient can't defend themselves, and that's common after chemotherapy. Your priority is to assess for fever and symptoms of infection and use isolation precautions if indicated. In a patient with a low white count, fever is never a small finding. 4. Hemoglobin, 12 to 16 grams per deciliter in women, 14 to 18 in men. Hemoglobin carries oxygen. When it drops, oxygen delivery drops with it, and the patient usually tells you before the lab does. Fatigue, shortness of breath, dizziness. Your priority is to assess oxygenation, assess bleeding risk, and watch for the classic anemia symptoms. 5. Platelets, 150,000 to 400,000. Platelets help the blood clot. A low count means greater bleeding risk. A high count means risk of clot formation. Your priority with a low count is to monitor for bruising and bleeding and put the appropriate precautions in place. Soft toothbrush, no razors, fall prevention, and report new bleeding when you find it. 6. Creatinine, 0.6 to 1.3 milligrams per deciliter, and ranges may vary by lab, so check yours. Creatinine reflects kidney function. When it rises, the kidneys are not clearing what they should, and the patient may not be clearing medications either. Your priority is to monitor urine output, review nephrotoxic medications, and assess hydration status. 7. Glucose. Glucose is energy for cells. Know your facility's reference range. A common teaching ballpark for fasting glucose is 70 to 100 milligrams per deciliter. Low glucose shows up as sweating, shaking, and confusion, and it moves fast. High glucose shows up as increased thirst, frequent urination, and fatigue. Your priority is to recognize the symptoms quickly and follow your facility's protocols. 8. Troponin. Troponin may rise with heart muscle injury, and thresholds depend on the assay your lab runs, so use your lab's cutoff. Your priority is speed. An elevated troponin is evaluated immediately. Assess chest pain, take a full set of vital signs, and follow your chest pain protocols. 9. INR. INR monitors warfarin therapy. A high INR means higher bleeding risk. A low INR means insufficient anticoagulation. Your priority is to assess for bleeding head to toe and verify the medication history, including new prescriptions and anything that changed recently. 10. Lactate. An elevated lactate may indicate poor tissue perfusion, and you'll see it in sepsis. Your priority is to recognize deterioration early and follow your facility's sepsis protocols. Now let's put it together on one patient. Temperature 102 degrees Fahrenheit. Heart rate 122. Blood pressure 88/54. White blood cell count 18,500. Lactate 4.2 millimoles per liter. What concerns you the most? Learn the ranges. The white count is high. The lactate is elevated. The heart rate is fast, and the blood pressure is low. Ask why. Fever with a white count of 18,500 says the body is fighting infection. A heart rate of 122 with a pressure of 88/54 says the body is compensating and losing ground. A lactate of 4.2 says tissue is not getting the oxygen it needs. Build the clinical picture. These aren't 5 separate findings. They're one process. Infection plus poor perfusion. That's the sepsis pathway. Select the safest nursing action. This patient is deteriorating. Stay with them. Recheck the blood pressure, confirm IV access, apply oxygen as indicated, and notify the provider or activate rapid response per your facility's criteria. Initiate your sepsis protocol, then follow urine output and mental status, because those tell you whether perfusion is improving. You don't wait for the next set of labs to act on this. 4 things to carry with you. Lab values are interpreted in the context of the patient's condition. Don't memorize numbers. Understand what each lab represents. Use the NurseWiz Labs framework. Learn the normal range. Ask why it's abnormal. Build the clinical picture. Select the safest nursing action. And consider trends and the overall clinical picture, not just a single value. Don't forget to like and subscribe to the NurseWiz channel.